Welcome. My name is Keith Lewis, and I'm the chairman of the Department of Anesthesiology and Perioperative Medicine at the Robert Wood Johnson Medical School. Prior to my arrival at Rutgers, I was chairman for almost 20 years at the Boston University School of Medicine. My number one priority throughout my entire career has really been resident education and training. And that passion and that commitment I've brought here to New Brunswick and our residency program. And that's continued to permeate my entire career. So first and foremost, I want to welcome you and thank you for applying to our program at the Rutgers Robert Wood Johnson Medical School. What's most exciting about New Brunswick right now and what's happening is this is the place to be. And let me explain to you a little bit about that. We're about a 600-bed academic medical center at the Robert Wood Johnson University Hospital. And in that setting at the present time, we have 23 ORs in the main OR and 6 ORs in our pediatric setting. The plan moving forward is we're investing almost $250 million to build 30 leading-edge ORs in the main hospital. In those 30 ORs, we'll have 5 hybrid rooms which will perform high-fidelity procedures in cardiac, neurosurgery, trauma, and what other specialty needs high imaging type techniques. So we'll become a full integrated platform where there isn't anything we can't handle in this location. Right next to our main inpatient ORs, we have the Bristol Myers Squibb Pediatric Hospital. This is a freestanding pediatric hospital attached to our main hospital by a corridor, and they have, in that particular setting, 6 ORs, and also inpatient beds and a PICU. So we're very fortunate that if you're a resident in our program, that everything you need to do is right here, side by side, and you do not need to travel. Across the street is the Cancer Institute in New Jersey, which is an outstanding multidisciplinary cancer center. And what's going to be happening in the future is we're going to be building an $800 million building that has 9 leading-edge cancer ORs. So if you look at the scope of what's happening here, we have 30 ORs in the main hospital, we have the 6 pediatric ORs, plus we have the 9 ORs in the cancer hospital. So the scope of the cases and what you'll see over the course of your 3-year training is really endless. In addition, we just acquired the Plum Surgery Center, which is about a block and a half outside of the main front doors of the hospital. And that's a place where you'll learn how to function more efficiently in an ambulatory type setting. So from my perspective, what's going on here, and with my outstanding faculty and group of residents and fellows in this environment, we are probably the most powerful program in the state of New Jersey. And most recently, my book came out, OK to Proceed, which is about what every healthcare provider needs to know about patient safety. 52 chapters, relatively brief. Each chapter has 2 short, well-developed animations of a case plus a simulation to really enforce the part of the case that is being stressed. This is embedded in your education on a weekly basis. Every week, Thursday morning, for 30 minutes, all the residents at New Jersey Medical School and Robert Wood Johnson Medical School have an interactive classroom that we flip, asking you questions about the essential components of each chapter. So by the end of 1 year, you would have gone through the entire curriculum of all 52 chapters. We partnered this with the Rutgers Leadership Academy with a leadership course tailored just to you specifically in anesthesia, teaching you the basic essentials about leadership and management. So as a resident, you have a highly unique experience that's not seen in many of the anesthesia programs. I think it's important for you as a resident, when you consider a program, to pick a program that has everything you need in that location. And I think we do that as well, if not better, than any program in all of New Jersey. So I want to challenge you to say, as you look for programs moving forward, that this is probably one of the most important decisions you'll ever make, because it really sets you up for your future, whether it be private practice or a fellowship program. We as a program have been incredibly successful with either job placement or, over the last several years, all the residents got the fellowship programs they wanted. So as a chairperson, I want to say thank you so much for applying to our program, and I am fully committed to your career development and ultimate success. Thank you very much.
I'm Scott Mallender. I'm the Anesthesia Residency Program Director, and I've been the Program Director for the past 5 years. I'm excited about where our program currently is and about the future direction of where our program is heading. As you heard from Dr. Lewis, we've really added to our residency curriculum as well as to our clinical footprint in the New Brunswick campus. We've really changed the way that we're doing education, and we've truly had to be adaptable with our current COVID pandemic. Overnight, we went from doing our lectures and conferences and grand rounds in person to having to do everything virtually. And as an anesthesiologist and the way that we're trained, we've all learned that we've had to be adaptable and flexible. And you could have one plan 1 minute, but you have to be willing to change it the next. And I think we've learned that even with our education. With that being said, we're a national leader in terms of our neurosurgical experience, our cardiac experience, as well as our adult and pediatric urologic experience and pediatric orthopedic experience and exposure. We have a top-notch adult orthopedic program in spine as well as in joint replacement. As the program director, one of the things that I'm most proud of is where do our residents start and where they finish. It is absolutely phenomenal to see somebody come in who's shy and timid and to see the anesthesiologist that they grow into upon their graduation. Furthermore, it's great to see where do our residents go in their careers? Where do they match for fellowship? Are they all matching the fellowships of their choice? And to top programs. We've had residents match to very prestigious programs, cardiothoracic anesthesia and critical care. In regional, to some of the top programs in the country, the Mayo Clinic in Florida, obstetrics, and pain. We do have 2 fellowship programs on our campus in cardiothoracic anesthesia as well as interventional pain management. And I think when you look at a residency program, you have to look at, are they going to be able to help me reach the future and the place that I want to be? Residents ask me all the time, and medical students, what program should I be looking for? And what I tell them is you need to take a look in the mirror. You need to be honest with yourself as the type of person, the type of physician that you want to be. And you have to ask yourself, what program am I going to be best in? And you have to try to match your personality to that program. Am I going to be better in a large program, medium, or small program? And be honest with yourself. Also, you want to ask yourself, am I going to be better in a program that just allows you to kind of figure it out on your own, or do I want to be in a program that helps nurture you? We're a program that helps nurture each resident, and we don't break you down and build you up. We try to take what your individual strengths are and develop those strengths, and also develop the weaknesses that you may have. But we treat everybody as an individual here. Through COVID, we made sure that everybody had proper protection, proper PPE, and we gave every member of our department, from our faculty to our CRNAs to our residents, 3M half-face respirators with the proper filters. So if you match with us, we want to assure you that you're going to be safe and protected. Additionally, if you match with us, you're going to leave this program as a very, very competent clinical anesthesiologist with a background in academics and a background in understanding leadership, patient safety, and what are the things that I need to accomplish to become tomorrow's leader in the field of anesthesia. And we're going to be committed to your safety and to helping you achieve your personal goals within our team environment. We truly do work as a team here.
My name is Christine Hunter-Frazzola, and I'd like to talk to you about our wellness program. The culture of our department is all about teamwork and wellness and professional communication. With all of the members of the department, that's something that we emphasize. So beginning with the residency, the first thing that you notice when you come to see us in the clinical academic building is our physical plant has been transformed. Calm environment that is conducive to learning and studying and doing administrative work. So that is the first change. We also have peaceful places to enjoy a quick snack. We have snacks available 24/7 for the residents when they have a long day in the operating room. The other thing is we've changed our hours of the residence, so the residency doesn't have prolonged hours, and our overnight call during the week is not 24 hours. And that helps with learning in the evenings. When you do have a difficult case, you can focus totally without being totally exhausted. We also have a mentor program, which is a support program for the residents, and all of the residents are assigned to a mentor. And we decide that usually about in the 6-week period. The residents can select a mentor or it can be assigned. We would like everybody to have that support person. And we ask for them to meet on a monthly basis to make sure that they are on goal with their educational needs as well as their career goals. And those are discussed to help keep an eye on everything that's going on during their educational period, so we make sure that everyone has the support they need. If we feel that there's a time where the residents need a little educational support, we do have additional education mentors which can help the residents and support them with some of their educational goals.
Hello, my name is Dr. Usman Shah, and I wanted to take a few minutes to share with you our educational offerings. As a CA1, you would benefit from daily lectures that are given throughout the first 2 months, and then subsequently you would have presentations that are given weekly throughout the year. These presentations are given by our general anesthesiologist and subspecialists, and they are immediately available on new innovations on our digital library. We offer mock oral board practice. Every month, a CA3 and an attending go through a formal examination where constructive criticism is given at the end of each session. One of the biggest hurdles that residents have is the lack of practice and rehearsal, and this gives residents the opportunity to do both things. By the time you take your actual oral board examination 1 year after graduation, you will be confident and you're going to do very well. In combination with the written board practice that you have throughout the year, you will definitely ace both your boards.
Hi, my name is Sagar Mungekar. I'm an Associate Program Director here at Rutgers. Training and educating residents is our priority. In the past few years, we've made changes to our educational curriculum. When you join our department here at Rutgers, you'll instantly have access to electronic textbooks and other resources free of charge. We'll also make available to you online question banks, different videos, toolkits, so that you can study what you want, where you want, all with your mobile device. We take a multimodal approach to our educational initiatives. We make sure that you have different resources available. Whenever we have an event in the OR, we take that event and convert that into a simulation. You'll have the opportunity to work with your perioperative nurses, other physicians, other residents, and relive some of those scenarios in a simulated setting. You'll have a chance to look at what areas of improvement you can do and the department can do. I am sure that when you graduate from this department, you will be the next generation of experts.
Hi everyone, my name is Kate Balby. I'm one of the chief residents here, and I'm going to be quickly talking to you about our call schedule. So every night we have 2 residents in-house, 1 CRNA and 1 attending. We have actually eliminated 24-hour weekday call, so now call residents come in at 3 p.m. and they stay till 7 a.m. the following morning. For weekends and holidays, it's a 24-hour call, and for a holiday call, we have what's called a comp day, which basically means you get a free vacation day later on in the year. You obviously get your post-call days off, and your pre-call days you actually get out early also. For every call, you get a $20 meal voucher that you can use in the cafeteria. We have an automated software system that equally divides call among the residents, and overnight we have great support. You're never alone. You always have an attending CRNA and a second resident as backup, and you really have a good, strong team overnight. For all these reasons, I think we have a really great call system.
Hi, my name is Janak Bhatt, and I'm one of the chief residents. What I wanted to highlight for you guys today was one of my favorite aspects of the program, and that's how much the leadership cares about the residents. And this was especially highlighted throughout the COVID-19 pandemic, where the leadership took it upon themselves to make sure that each and every resident, and not just each resident, but every member of the department had the appropriate and necessary PPE for treating these COVID-19 patients. And I bring this up because it's not something that was unique to the pandemic. It's something that happened well before and something that will happen well beyond the pandemic. And that's one of the things that makes me proud of being a resident here, because one of the top priorities of the leadership is to make sure the residents are looked after, and it's also one of the reasons I decided to stay here for my fellowship.
Hi, my name is Justin Chacko. I'm one of the chief residents here, and what I wanted to talk about was how great the training we receive here is. So we're a level 1 trauma center. We treat mostly ASA 3 and 4 patients. We have a very busy cardiac surgery program, and the faculty here are excellent. They take the time to teach you both in the operating room and with educational sessions outside of the operating room. Mock oral exams, we have simulations once a month in our sim lab, and one of the other nice things about working here is that we have no shortage of resources. So you have McGraths in every room, our anesthesia techs are excellent and very helpful, and overall it's a great place to train, so I hope you choose to come here.
So I did my residency here, and I really felt like our department was one big family unit. And the support is just unwavering. And now that I'm here as a faculty member, I feel that support 100%. And I'm so happy to feel like I'm at home when I'm at work. Very grateful to be in a place like that.
Hi, I'm Robert Honko, an attending anesthesiologist and interventional pain physician. Upon completing my residency and fellowship here in 2016, I went on to private practice where I was for 3.5 years. My experience and training here prepared me for everything that I saw in clinical practice in the real world. Never once did I see anything in practice that I hadn't seen in my time here. After 3.5 years, I felt like something was missing, and I decided to come back to a place that I like to call home. I came back for a few reasons. One, the sense of camaraderie that you get working here. I've always felt like somebody had my back, and I never felt alone. I always felt like there would be somebody to help me if I got into a clinical situation that needed it. In addition, I wanted to contribute more to the education of residents, fellows, and my future colleagues. I look forward to training you in the future. Thanks.
My decision to come to Rutgers was an easy decision. It was guided by the patient population as well as the diversity amongst the staff, as well as the training here at a level 1 trauma center. I knew the training would be top of the line and I would be prepared to see anything I can encounter in this outside world.
Well, I was at an advantage. I went to Rutgers for not only undergrad, but medical school, and also I did an internal medicine residency. So my pathway to anesthesia was a little unconventional. But when I was making my decision, I knew that Rutgers would provide me with the qualities I was looking for in a program, and that's an excellent educational experience, a great clinical experience, and a diverse community that I knew really needed me. So when I was making the decision, it was an easy choice.
In speaking as the program director, I want you to know that we as a department are absolutely committed to you becoming the best version of yourself that you can be.